So I'm going to move on. I'm going to introduce the first topic, which we thought was important because we wanted to set the scene of now. The importance of this conference, really, here we are, 1st of October 2020, and we wanted to look at what the experience for people with cerebral palsy during lockdown and what the restrictions have meant for people, and explore that a bit, really, so that we can all understand how we want to move forward, hopefully as restrictions are lifting, or how we want to support people as restrictions continue. So I am hoping to be joined by Tressa Burke, who is the Chief Executive of the Glasgow Disability Alliance, and so that we can look not just at the experiences we as Cerebral Palsy Scotland have been finding, but also in a wider Scottish context. Graham, could I have the first slide, please? Yes, just to remind you of our new logo, that we are now Cerebral Palsy Scotland, and to thank you all for joining this session. Please, as Anna has just said, please don't be shy. Please submit your questions on the right-hand side in the Q&A whenever you feel like. We don't have to attribute questions. If you want to ask anything anonymously, that's absolutely fine. And please help us get trending with hashtag CPScotConf. So can I have the next slide, please, Graham? So as I said, our organisation changed its name on the 1st of April 2020. But what we didn't change was our mission, if you like. Wellbeing Scotland's mission was to help people with cerebral palsy. Cerebral Palsy Scotland's mission is absolutely to be there for people with cerebral palsy in Scotland and for the CP community. And this is our mission statement, if you like, which always sounds a very corporate thing that people in offices and around board tables worry about. But we wanted to share it with you because we wanted to emphasize that our mission hasn't changed, it has widened. The name change for us was a long-planned strategic change. We're still committed to providing BOBAth therapy, and we're still committed to training BOBAth therapists. But we do more than just provide therapy, as today is an illustration, and we wanted to reflect that wider engagement. We also wanted to break down any barriers for anybody finding us, accessing our services. And therefore, our new name was really to encompass, we do what we say on the tin. So we're here to focus on the CP community today. I'm very aware that people are joining this conference from very different backgrounds. We have families, we have people with CP, we have carers, health, education, social work professionals. And so I think it's really a valuable space for us to reflect 6 months into a global pandemic, how we can help people now, and what should, as our mission statement says, what should knowledgeable, compassionate services and support for people with CP in a global pandemic look like? Can I have the next slide, please, Graham? Thank you. So this is just a catch-up of what we, Cerebral Palsy Scotland, have been doing since the 23rd of March. We did manage to get our building in Scotland, our centre in Glasgow, rebranded, which was quite difficult during lockdown. But that was one of the first things that that happened, was that on the 1st of April we rebranded to become Cerebral Palsy Scotland. But on the 16th of March, both the UK and the Scottish Government specifically named CP as a condition that caused people to be vulnerable to the virus. And so what we saw was a huge number of inquiries coming through to us. And actually that's where the name change, I think, really, really helped, because people that were searching for CP and advice, CP organisations, I think managed to get to us quite quickly. Our centre had to close on the 23rd of March. We had stopped any outreach, any group activity in person. Therapy in person was no longer feasible. And so we very quickly had to pivot to see what we could do to support people through COVID. I think we were probably the first organisation. I haven't had any knowledge to tell me otherwise, but I think we were the first organisation to publish specific CP and how people with CP might be affected by COVID advice. And we certainly got a lot of hits on that page on our website. And it was shared worldwide. One of the comments we got, which I think was from North America, there has been minimal intelligent comment about what to do, especially for people with cerebral palsy. Your site is full of intelligent, practical advice that is CP related. And that was really important to us. And it was a lovely comment to get early on. And it inspired us really to work out that we needed to interpret the advice with a CP lens through a clinical specific expertise of how does this affect people with CP. So we quickly pivoted our services. We were very lucky that we were already signed up to the NHS Near Me Attend Anywhere virtual consulting system. So we were able to offer secure one-to-one clinical online sessions and to anybody that had an internet connection. We pulled together a weekly Zoom group for adults with CP just to keep in touch, just to find out, what the issues were, how we could help, to have a social moment. It was coffee if it was in the morning, it was tea if it was in the afternoon. The weekly update went out to over 1,500 people each week. It got quite hairy because Nicola Sturgeon would announce her new updates on a Thursday at 12:30, and our weekly update went out before the end of the day on Thursday. Again, looking at what is the CP slant on the updated guidance. And interestingly, sometimes we got fair warning from Scottish Government because we were one of the organisations that government and policymakers were asking, what is it like? What should we be doing? So, for example, the Scottish Government pulled together a shielding policy team, and they were really interested to hear how their policy guidance was affecting people on the ground. And we were one of the organisations that were able to feed that back. We also, in that point about wanting to know what life was like, we undertook 2 impact surveys, one in May and a follow-up in September. And as a result of that, I was very pleased that we were able to reopen the centre when we got to phase 3 of the Scottish Government's reopening post-COVID, because our survey in May showed how important it was for people to access an in-person, hands-on therapy service. So yes, it's different. Yes, there's lots of perspex and PPE and hand sanitizer, but actually reopening the centre the week of the 13th of July was wonderful, actually. And touch wood, we're not allowed to touch anything these days, but it has remained open on a much, it's challenging because we can't have so many people in the centre, but we are slow and steady and remaining open. Could I have the next slide, please, Graham? Thank you. So our survey in May, quick snapshot. Our survey in May told us that the situation of being locked down was hugely impacting on people's physical health. Mental health was suffering too, carers were suffering, and unsurprisingly, people had appointments cancelled and found it quite difficult to make contact sometimes with health professionals. The survey, just to give you a bit of context, we received responses from all over Scotland. And interestingly, 50% of the responses were from people on behalf of children and 50% were adults with CP. But people were worried, and this anxiety and worry came through hugely. People were worried about developing difficulties, particularly around mobility, that they wouldn't get back. Families were worried about development of children, or just being able to access things that before COVID people took for granted. So whether that was podiatry appointments or dental appointments, you know, the impact of that was causing even more anxiety than the impact of being told to just steer clear of, you know, stay in your home and stay apart from crowded places and people. Could I have the next slide, please? So as I said, we followed up our survey because we wanted to track changes. So we followed up our survey in 2020, and I'm going to talk a little bit about each of these categories. So health and wellbeing, shielding, care arrangements, accessing healthcare, family life and schooling, because these were the categories that came back, that we asked about, and that responses came back very strongly. The reason we repeated it in late August, early September, we repeated our survey, was because at that point, shielding had been paused, schools had reopened, and we, as Cerebral Palsy Scotland, were able to offer in-person support. And I know that we're still living in a time of uncertainty as far as restrictions are concerned, but those three things are still, as of today, at this moment in time, still applicable. So schools are still open, we are still open, offering therapy services, and shielding remains paused. And again, this part 2 of the survey, responses came from all over Scotland. It was pretty fairly split between children and adults, and you know, not only children, adults, but older adults as well. So it was a great response. So thank you to everybody who did respond to us. It's been hugely helpful. Graham, next slide, please. So if we focus on health and well-being, 55% in September reported that they had seen a deterioration in their physical health, and 53% confirmed that they had seen a deterioration in mental health. This was slightly, you know, people commented about the overwhelming feelings of anxiety, on the lack of opportunities to exercise, so difficulty in finding community facilities, be it swimming pools or parks or gyms or wherever it might be, but the fact that you know, that they have been, community facilities have been slow to open or not allowed to open, has increased this feeling of isolation, of not being able to do stuff, and therefore, you know, a feeling of that health is just worsening. Unable to access routine things. So being able to, you know, not have a normal routine during the day contributed to these feelings of isolation and indeed boredom. You know, how do our day, I think we can all sympathize with this, but this was the kind of thing that was reported. You know, no physio was available. All normal everyday life in and around the community vanished, leading to boredom and lack of routine. Interestingly, those who were already connected to good community support programs, so particularly, and I'm going to do a shout out for disability support programs, they have a session later, so please, you know, please go and hear what they have to say. But it was interesting that in our surveys, people that were involved in sport programs, somebody reported, you know, it might be a very intense program like para sport, so they kept training through lockdown, and that helped them with this lack of routine or boredom or worry about decline. But it, you know, doing it on your own did emphasize some challenges for people that you know, it's very difficult to keep going in a sport program on your own. One mum reported that her son's physical health had probably got better than pre-lockdown because he was able to use his running bike out in the street every day. And he can now, this is mum reported, he can now move in the bike independently. He wasn't able to do that before. Next slide, please. shielding. 30% of our survey classed themselves as shielding, but only 8% had received an official letter. And I think this is a hugely important thing, and it's something we've been feeding back to government and policymakers, because there was huge confusion around shielding, and there was we saw a huge variation on who was being shielded around the country. We saw that, you know, different people were asking different professionals about whether they should be shielding. So, for example, some people were speaking to consultants who were adding people to the list. Other people were speaking to their GPs. Somebody reported, well, my GP didn't know, so she put me on the list to make, you know, to be on the safe side. And I think the huge implications of being shielded was something that perhaps none of us have appreciated really. There was a lot of anxiety around people who felt that they should be shielded and they didn't understand why they hadn't been. And similarly, there was anxiety from people who did receive a letter and were being shielded, but saw their peers not being shielded and didn't understand why that was. So for many people, not understanding the logic was part of the problem, if you like. It also, I think the shielding, as we reflected on it, meant that people didn't feel equipped to make informed decisions about their own level of risk. So, you know, people didn't understand, in a way, the huge implications of shielding and what that meant maybe for their families. So one mum said to me, I have known how to deal with the risks for my daughter ever since she's been born. I felt very comfortable in making those decisions. But during this time, I feel that's been taken away and I haven't been able to have a sensible conversation about the level of risk. Similarly, another mum had managed to speak to to her child's consultant and had a very sensible discussion about risk. And I think, I'm sure I will come back to this again and again, because it's something that's really struck me, that COVID is not, it does not affect all people equally, and CP does not affect all people equally. So there are huge variations depending on your own individual circumstances. And therefore, knowing who to discuss about what is the risk to you and how do you handle that is a huge challenge. And I would say that certainly when I speak to clinicians, so, neurologists and people who also are really worried, because they, when being asked who should we shield by Scottish Government, are always going to vary on the side of caution, particularly during this pandemic, when in March we knew very little about COVID, and we are still learning today as we go along. It's changing very fast, and we're learning every day. So this discussion about how we assess our risk is something that I feel is really, really important. Can I have the next slide, please? Care arrangements. This was another biggie. I find it absolutely astonishing and extremely worrying that our survey reported that pre-COVID care arrangements have not been restored for 71% of our respondents. And this is something that I can assure you that we are feeding in to government and anybody else that will listen to us. I'm sure Tressa will come on to this later. It's an absolute stark reality figure of that we may all be in the same sea of this pandemic, but we're certainly not all in the same boat. So many people relied on family carers. And a lot of people, particularly at the beginning of lockdown, didn't want people coming into their homes. So whilst support was cancelled, support groups were cancelled, day centres were closed, people also were worried about people coming into their home and how could we make that safe. So the fact that that again, it's back to my point about risk, that actually we had a lot of inquiries that we responded to about actually thinking about how important it is to stay well and how important it is for carers to come into the home, and that people coming into your home, you can minimize risk by talking about where is somebody going to be in the home, what do you want them to do, what PPE should people be wearing, those kind of questions if it's carers coming in, but simply, for example, family carers. So many people rely on family carers, and I know the fact that grandparents couldn't come round was a huge issue for people, and I'm pleased to say that in the current guidelines, Scottish Government have exempted grandparents. They are allowed to come into your home to help with childcare. So I'm going to take that as a little win, because that's something that we did highlight, that this was something that was really affecting people. A lot of adults with CP moved back with their parents, so they were relying on older adults for all their care. And the other thing we found is that a lot of arrangements, so for example, people leaving school, or people moving to new homes or new settings, that kind of planning paused. So the Scottish Transitions Forum, for example, had ran a survey about how many people knew what the transition plan might be for their child on leaving school, and something like 80% didn't know what the plan was in June. I think that just all emphasises, for parents and for children, that the reopening of schools and nurseries was absolutely crucial, because so much for parents who are carers, so much of their respite care happens because children can go to school and receive services in school. Next slide, please. Healthcare. Again, it is still difficult to access healthcare professionals. What we found is that many people were reporting they could speak to a healthcare professional online or by telephone only, but it's the hands-on. It's back to the point about declining physical health and worrying about getting stiffer and issues with pain and those kind of things. Access to physio, occupational therapy, speech and language therapy in person is really important. And these services in Scotland are being extremely slow to remobilise. I was at a meeting with Scottish representatives from the Chartered Society for Physios, Royal College of Speech and Language Therapists, and the Royal College of OTs, and the representative from the Chartered Society of Physiotherapists said there is nothing in their guidance that prevents people offering a service at this moment under current guidelines. We certainly at Cerebral Palsy Scotland follow our professional body's guidance. We risk assess everybody that comes in. Those of you that have been into the Centre for Therapy will attest to the fact that there are processes around how we minimise infection risks for people, and it is very sad to me that these services in the community seem to be risk assessing on the basis that they can't help people. I know some people, now please rest assured, there are some people who are going over and above, but I also know that there are some people who are trying to provide clinics in community healthcare and aren't being able to because management haven't, the management aren't allowing things to open or whatever it might be. And I think that's something that we need to look at, and it's back to, let's look at the risk to our population if we don't provide these services. As far as mental health services are concerned, there seems to be absolutely little access to that. I am so thrilled that Joy Nisbet, who we have been working with at Cerebral Palsy Scotland as a consultant clinical psychologist, is coming on to look at issues for people with cerebral palsy around mental health. She is very aware that this has been something that has come up again and again in our lived experience evidence. Other things, children grow out of their equipment. It's unsurprising 6 months on that actually, we need to look at where people are now and ensure that, that we can help. And I think organisations like Cerebral Palsy Scotland are looking at how do we as an organisation act as triaging. So if we find someone with, family or whoever it is with issues that do need being seen by healthcare services in the NHS, that we actually are able to highlight the need and to triage that referral up so that actually people are able to help. Next slide, please. Family life. 76% reported that COVID had put more pressure on family life. I wonder if this is just for people with CP, or actually this is probably I suspect there are many, many families out there who are feeling the pressure, but particularly this was our survey for people with CP. I think the issue that we found as regards family is that people who were struggling anyway with the lockdown restrictions, so people might be trying to work from home, they might be trying to deal with siblings and homeschooling, and they also, on top of that, might have to deal with the physical care of someone who needs a lot of care and support. And this is why, access to carers, access to respite, access to help, was so important, because the strains of just trying to keep all that going for people were huge. People reported feeling exhausted, unsupported. As I've said, adults were relying on elderly parents. This lack of access to community assets and care really added to the stress. I know that also that there were issues with many carers or PAs who also had their own family issues, or maybe off, or maybe shielding. So, it's a complicated picture here. But I think, we felt that families were reporting to us that they felt ignored, they felt isolated, they felt left, and they felt struggling. They felt that they were struggling. Next slide, please. So I was delighted when we managed to reopen the schools, because school is so much more than just education. But I was very aware for our population that people might be very anxious about sending children back to school. Delighted to report that 79% of parents have sent their children back to school. Others are still, of the 20%, 21% that didn't, there were 20% of that felt that school or nursery was not safe for their child. I know one mum said to me, I've been shielding for all this time, I'm not about to send my child back to somewhere where I don't feel it's safe. And another 20% reported that the school or nursery couldn't currently accommodate their child. Nurseries and schools being shut was clearly very, very tough. I know that other families are waiting for a start date and are in discussion with their local schools or nursery to assess the impact of the reopening of schools before they send their child back. As one mum said, trying to work from home, provide full-time care for my child, and provide care and supervise schoolwork for her siblings single-handedly was extremely challenging. I believe my child with CP suffered as a result due to the lack of time to carry out any activities during the day. Next slide, please. Now, I've talked a lot about our surveys and what the impact is for people with cerebral palsy in Scotland, but I also wanted to look around and make this wider. Is what people with cerebral palsy were feeling, is that shared throughout wider populations, which I believe it is, but it's always good to see where the evidence is. Public Health Scotland ran a survey in August. Well, they published it in August, sorry. They ran this survey during the first 12 weeks of shielding, and they published it in August around the impact of shielding. And you can see the statistics here. And this is from anybody who was shielding. The survey was gathered responses from 12,851 people, which actually was only 7% of the shielding population. Much of the report covers the availability of food, either around people being able to access online food delivery slots or receiving free food boxes. Because clearly that was a real worry. If you're going to ask people to stay in their home, how do we support them in order to, in order to keep well? The other thing, when you dug into this survey, the thing that interested me, the survey found that older Scots and those with severe respiratory illnesses were most likely to adhere completely to the guidance on shielding, which included not leaving their home, not having visitors, and distancing from people within their own household. People were more likely to cope with shielding. If they reported they were more likely to cope with shielding, it didn't necessarily mean that they had adhered to every bit of the shielding guidance. And the report acknowledges that in the future it may be important to tailor advice to people. And I think this is back to my thing about risk, that some people were able to tailor the shielding advice to suit them, others weren't. People that were unemployed or not working because of a long-term condition were most likely to have found shielding the most difficult and a really negative experience. And similarly, those who were financially better off were better able to cope. Now, can I have the next slide, please? Because I think at this point I'd like to bring in Tressa, who I think is on the call. Tressa, as I've said, is the Chief Executive of the Glasgow Disability Alliance, who also, like us, ran a lived experience survey, Supercharged, a Human Catastrophe. Hello, Tressa. Welcome to our online conference. It's lovely to have you here. I wonder if you're able to just talk us through, I know you've been listening to some of the things I've been saying about our cerebral palsy surveys, and I wonder if you could just talk about, do some of the things that we've spoken about chime with where you are and what you've experienced in your organisation?
Yeah, absolutely. Thank you, Stephanie. It was great to hear about your surveys. I'd read them already in preparing for today, and so much of it chimes. I don't think there's a thing that doesn't at all. Our organisations have got so much in common. Of course, we have lots of people with CP and with many other conditions as well. So I'm a disabled person myself, and the board of GD are all disabled people. Yeah, we started off by doing wellbeing checks with our members. And in the end, our report's been put together using the intelligence that we got from 8,500 phone calls, from a couple of thousand surveys, more than that. I think it was 2,100 and odd that were filled in SurveyMonkey, and a huge amount of interaction through both mail and written correspondence and emails as well. And all that has been synthesised. Everything that you were saying about confusion about the guidance, absolute confusion. And I think you may have been alluding to this earlier, the point about that in itself was problematic, because it meant that people maybe weren't quite trusting the advice as well, when it was so obvious that two people with the same condition and the same treatment plans, I mean, it would be maybe slightly different if they didn't have similar treatment plans, but they were on the same medical regime, where one was shielded and one wasn't. Just made no sense at all, and it did make people query other information and guidance that was happening. Of course, that also wasn't helped by a Four Nations approach, which meant that people were watching different news articles and they were hearing different things at different points of the day, so they were getting confused about that as well. Impacts on physical and mental health and wellbeing were really staggering for our members as well. Access to health services, and of course we know that so many appointments, ordinary routine plans of treatment and ongoing therapy were cancelled. I think 73% in the month of April were cancelled. Access to social care was terribly affected in Glasgow, and of course you're covering the whole of Scotland, and certainly not every local authority followed suit, but in Glasgow 1,884 packages were cancelled right at the outset of lockdown. That was a stat that the BBC got from Glasgow. I didn't get that directly myself. Glasgow's stat to us was 1,700, and then we heard it was 2,000. So it was really difficult to keep track. But again, you pointed in your comments, and I think this is a very fair and level-handed approach, that it is a complicated picture. And we know that in Glasgow, 680 caring staff went off shielding. Well, went off sick. I think 400 of them had shielding letters, and the rest were caring for people who were shielding or caring for children. So it is a complicated picture, and I think you kind of feel angry about what's happened to certainly our members. I know you feel the same, but you have to have the perspective and the understanding that this was a global pandemic, unforeseen for us all as a society, and we were dealing with already fragile systems. I think that is the more worrying point about it, that the near total collapse of social care was because the system was so fragile.
Well, Tressa, I wanted to ask you about this because your report highlights that there were barriers and inequalities faced for our populations pre-COVID, and this has been amplified or supercharged, as you call it, during COVID. So how do we ensure that disabled people's voices and expertise are heard particularly in Scotland's social and economic recovery? How do we do that?
Yeah, well, what we're saying is our recommendations are we need to supercharge. We're saying the inequalities have been supercharged, and therefore the solution is to supercharge disabled people's involvement, the rights and the support that they have. And we've got 15 recommendations that we make. But I think that if we'd had disabled people had been involved properly in disaster planning, if there had been, one of the things I would say is that I'm not a person with a health background. That's not my professional background. I'm a social worker to trade. But one of the things we have heard is that there were early warnings of this with other viruses and other things that had come before. And yet still no planning was done. So I'm not even talking about the plans about how you deal with the health impact, but actually how you deal with things like, if you make a huge number of people shield, how do you then make sure that they're provided for during that time? If you know, as we have known for some time, that there is an incredibly fragile social care system in Scotland and across the UK, it's not just in Scotland, how do you make sure that with a global pandemic, the near collapse of that doesn't mean that people's human rights are eroded right from the get-go? So I think that one of the very obvious and really pretty straightforward ways of doing that is to supercharge disabled people's involvement, to listen to their voices, to work with organisations like CP Scotland, like Glasgow Disability Alliance, who work to provide various things and supports to disabled people, but also to make sure that they have a voice. I think that is the number one thing that we would like to see happen.
I have to say that I found it interesting in our experience during this, how Scottish Government was so keen to pick up some evidence, and I don't know whether this is something that you would agree with me, but Scottish Government were definitely on listening mode. And we had a number of meetings with officials around how restrictions were impacting on people. And I did mention the fact that, grandparents are now allowed into the home for childcare. But I think that's all very well. But you mentioned about the local authorities not reinstating care packages. And my anger, I suppose, is that Scottish Government may say one thing, but it may not translate to happening on the ground.
Yeah. So there's so much in that. I think, first of all, congratulations on that win, as you say, that they listened. I think that was a fantastic outcome and it benefits so many people. Scottish Government were in listening mode, and like yourself, I imagine I was on the phone to Cabinet Secretaries within days of lockdown, and that wasn't because they were taking my call, it's because they were phoning organisations and organising conference calls straight away before we even had all the online Zoom and all the different platforms that we're using now. So they were very much in listening mode. What I did notice was, and I understand why this probably is the case, local authorities disappeared. I know that they were getting themselves in order. They were taking staff from areas and putting them into shielding organisation. They were doing all sorts of things, and I cannot imagine the logistical challenges that that must have created for them. But they didn't immediately engage with the community organisations or with the third sector. That came later, and they are doing that now, but I did notice that. Your point about the Scottish Government saying one thing and local authorities doing another, I think is a massive, massive issue in Scotland, and at the heart of so much of what needs to be reset. I think the relationship between Scottish Government and local authorities needs to be reset. The relationship between local authorities and Scottish Government and third sector and community sector needs to be reset. And one of the reasons why the Scottish Government were listening so keenly was because they realised, I think, as do hopefully local authorities, that the people who actually know the needs are the people on the ground, like CP Scotland, like Glasgow Disability Alliance and others. We were the ones that were actually supporting people during the worst of times. And I mean, Glasgow Disability Alliance has been delivering food. This is not an area that I wanted to develop into. This is not an empire we wanted to build in any way. It was driven entirely by need, and it needed really decisive and swift action to actually make sure that people went.
I think that's a really important point, because we found that because people couldn't get advice from clinicians, for example, or they couldn't, so somebody in our survey reported that they had written to their neurologist and still not had a reply, and their appointment that was in October has been postponed till January now. So we found that people were turning to third sector organisations because we were there, we were on the ground, we were able to, and I think it's back to my point about triaging. We are on the ground able to say this person needs better help now. And I suppose there aren't any politicians today on this call, but if there were, I'd be saying, for goodness sake, please listen to us on these issues. Just before we take some questions, I wondered whether you wanted to make a comment about digital exclusion and isolation, because there's a lot of evidence coming in about, particularly from NHS boards, about how wonderful all this digital stuff is. And in many cases, it is wonderful, because we've got people from all over the country here today that wouldn't be able to make it to Glasgow if we had a physical conference. But I have a big warning sign on digital exclusion and understanding information and the pros and cons. And I wondered whether you wanted to say a bit on that.
Yeah, absolutely. Really quickly, we became involved with Connecting Scotland, which is the kind of strategic policy about getting people across the whole of Scotland connected up. And it's absolutely wonderful. And we've given out maybe about, I think, 170 different pieces of equipment, between devices, actual iPads and all sorts of things, but also pieces of equipment that make using technology more accessible. And there's a wonderful story to be told about all that, and absolutely we will tell that story. What I would say is a few things. One, taking somebody from being digitally excluded, and I mean people who've never turned on a device before or held one in their hands, to actually being able to get online or use it in any meaningful way, it requires intensive coaching and support. The people doing the coaching aren't IT specialists at GDA. We brought people in and trained them up, and there are a few steps ahead of the people, probably quite a few steps ahead, but by no means IT specialists. So I think there has been a vast underestimation about how much time that takes and how much support and coaching and encouragement people need to take. I mean, you think that people would be queuing up to take a device. We had to really persuade some people to take a device, and often it's the people who need things the most who ask for it the least. and they need persuasion and engagement. So that's one thing I would say. The other thing is that has been vastly, I think, it's not understood. Certainly the government understand this, but access and connections to broadband. So giving people a Wi-Fi access, which is 20 gigabytes a month, that sounds good at first, until you realise that every time they want to take part in a GDA session, it might use 5 or 7 gigabytes. So in actual fact, that's quite limiting. So what people need is access to what you and I have, which is broadband all the time, unlimited. And that's, you know, to really change people's lives. I've heard it said at meetings that actually we're starting to get to the place where digital connections and digital participation is almost becoming a human right, not just because of where we are in COVID, but because of the way that the direction of the world is going in technology and being online. But the bit that I think is incredibly important to say, which is not being said, it seems unpopular and possibly dissenting from this rhetoric that we're hearing about connecting everybody up. Digital connection is not for everybody, and it's not me that's saying that. It's on the basis of the evidence that many people are just refusing. People who I think could benefit from it and do need it, but their confidence is so low, their life aspirations are low. They don't see that as something that we would want to do. I might have a different view and think, oh my God, I just know that if you would take this, it could be great for your life and you love it. But it really doesn't matter what I think. It matters what they think. And so for right or wrong, for good or bad, it's never going to be a catch-all. We're never going to get everybody connected. I'd love it to be the case that everybody has the opportunity and people are turning it down, and that's their right. But at this point in time, they're not even all getting the opportunity. So we're in a place where, you know, not everybody's connected up, and online is not going to be the be all and end all. So we're still sending out mailings, Stephanie. We've sent out 25,000 mailings to our members over the piece. Every time we send something, it's 5,000. So it might be more than that now. It might be 30,000. We might have done 6, I think, at this point. But that's really, really important, because people don't all have access. Even if they have access, they don't necessarily have the confidence to use it, and that's just all taking a bit more time than I think is appreciated. But it's so, so important.
I completely agree with you. I'm just going to pull in Anna here, because Anna, she's been fielding all the questions that have been coming in. So Anna, do you want to fire off to anything that?
Yep. Just a couple of comments to start with. First comment from Richard Luke. So morning, Richard. It's nice to have you with us. He just commented about the feeling of neglect and isolation was also felt very keenly in England and Wales. And he commented that one of the main issues that Scope was contacted about was carers and personal assistants not understanding COVID guidelines or simply not showing up. And he was wanting to know, was this a similar issue in Scotland? And just another point around carers. Another comment that people are still worried, concerned about carers coming into their home, and that being an ongoing issue. So, you know, if you would like to comment on both of those.
So the first thing I would say is that I had replied in the chat just saying that, yeah, people had gone off shielding or looking after family members, or indeed looking after their children or grandchildren. So I think them not showing up was sometimes about that, but I think also there was confusion. Different regions, different areas, different health boards were given different information and advice. I've got friends in social work all over Scotland, and one particular friend's a home care manager, and there was confusion about what information carers were getting going into houses. Was it okay to go in? They didn't all have PPE at the outset. I think that was another factor. Was it okay to go into somebody with COVID and then go and care for somebody else, was a question that was asked, and there were varying answers to that at the time. And I think we just need to accept and acknowledge and not pretend that we didn't know what we were dealing with. when this happened in March and then moving into April, you know, I think everybody was on the back foot. Everybody was trying to keep services going, but not quite sure if it was safe to do that. And obviously I don't speak at all for the service providers, but it seems to me that that was happening in Scotland as well. So in relation to the first question, can you repeat the second question? Sorry.
Yeah, it was just about the concerns around people still having concerns about carers coming into their home, and that kind of continuing to be an ongoing issue post-lockdown.
Yes, and I think that with the advice changing regularly, and I do believe genuinely that the First Minister has done a wonderful job at keeping it as clear as you can, but it is complicated. It was really clear at the start, full lockdown, stay in your houses, don't see anybody, stay safe. That was easy. Wash your hands. That was. I'm not saying it was easy. It was, but the message was clear. I think when we're hearing now, particularly now, about not going into each other's homes, where people had maybe started to get their care packages back, I can understand some disabled people and parents and carers being frightened of having people coming back into the houses because of that message. And you know, I think it does depend on hygiene procedures being followed, people having access to the PPE, people following the guidelines. And so I think there is still some confusion because we're hearing different messages at different times, and the messages change as things move on. And I think that's probably a result of it. I think also the truth is that the numbers going up means that people are again increasingly fearful, and rightly so. So I don't know if there is a clear answer to that, but I know that there are some disabled people who use their own packages of care and support using self-directed support option 1, and I think that maybe they feel a wee bit more in control because they know who the houses are that the people are going to, and presumably it is only theirs, and that they're following hygiene procedures. Whereas if you get a home care service from a social work department, you know that the people are in and out of lots of people's houses, and that seems to pose more of an increased risk. So that would really be my thoughts on that.
I think we definitely got a lot of people worried about people coming into the house, and I think that is still continuing. And you're right, Tressa, that the local lockdowns were confusing at some point, but we're kind of now getting back, particularly in Scotland, to a place where you just can't go into anybody's house. And is that a problem? Again, I come back to my thing about we need to have a discussion about risk, because one of the things we have said from early March, and you're absolutely right, we didn't know what we were dealing with in March. We are learning, as I said, every day there is a new something coming out that we are learning. But keeping well, I mean, one of our best defenses against COVID is to keep well and healthy. So if what we were saying to people, and we were saying it again and again and again, and we were saying it to carers, you know, that the most important thing is to keep people well and healthy. And if we can keep them well and healthy, then that's the best defense against COVID that everybody's got. I think your point about PPE is valid. At the beginning, we didn't have PPE. We didn't even really know what PPE was. And, you know, again, access to that and what was, you know, where people could get PPE was very, very varied across the country. But I think I would say, the one thing I would say, and this comes from doing our risk assessment for Cerebral Palsy Scotland, it's a lot easier to risk assess for a home visit than it is for a centre where lots of families are coming in. Because if you are risk assessing for your home, you are in control of the hygiene and the procedure and where people go. And actually, that's the big point about people not visiting people in their homes. In restaurants and hospitality settings and pubs, there are rules. You can only open if you clean and you do everything and you follow the guidelines. Whereas, thank goodness, the government can't tell us what to do inside our own homes. But it's about following those hygiene procedures, and that's, you know, that's what's so important. But my big message is keep well.
Just a very quick question here. Just, I know we're kind of coming to the end of the session, but a comment, a question from somebody, I think really just with respect to mental health and, you know, people with CP, you know, might they feel like giving up, in the context of everything that's going on. So I think a comment really just reflecting on the mental health impact of all of this.
I mean, I feel I've glossed over mental health a little bit because I'm very aware that we've got a session later on today, and I don't mean to gloss over it in any shape or form, because I think it is a real issue, and I think access to good mental health services, and certainly, for people with CP, we know that there's a real issue that people just don't understand CP. But what I would say is there are organisations there. Please never feel alone. There is the Glasgow Disability Alliance, there is Cerebral Palsy Scotland, there are other organisations like GDA all across, well, not quite as wonderful as GDA, but there are. Please do not feel alone. And I think the charities and third sector organisations have come into their own during this. They are there, they are open, and they may not have any experience in mental health, but they might be able to point you in a direction and support you to go in that direction. Anna, can I just go on to my final slide, Graham? Because I just wanted to, I'm very aware of time, and I wanted to end on a positive note. I mean, Tressa has talked about supercharging the voices of disabled people, and I think, we are, the Scottish Government, as far as next steps are concerned, have published their Remobilise, Recovery and Redesign framework. And people with CP are covered in this framework. They are covered because people with long-term conditions who have been affected because of the restrictions are specifically named, and lack of access to services is specifically named in this framework. We will be lobbying for remobilising services, and GDA are clearly shouting from the rooftops on this. But, somebody said in the comments, are government going to listen to disabled people's voices? Yes, they are doing that now. I think, Tressa, I don't know whether you want to make a comment on this, but I would say they are listening, and disabled people's voices are very important. So if you've got something to say, please say it, whether it's through an organisation or being introduced to whoever you need to go to next, but please say it.
Yeah, Stephanie, will I come in but just to say
yes.
words on that? So in relation to mental health, 62% of GDA members were concerned about their mental health, 90% and over 90% were concerned about both mental and physical health. So it is a massive issue, and lots of the mental health supports were also paused, or people were unable to get CPNs, people were unable to reach their services, lots of people were working from home, or people were just not available, and that was really problematic. And I think there were people with primary mental health conditions who were really impacted, and then everybody, whether you had a mental health condition or not, for disabled people, people's mental health was taking a hit, definitely. So it was incredibly important, and there is support out there. There are disabled people's organisations, there are organisations providing services to disabled people, and there is a lot of support, and there are the helplines. So there's the Samaritans helpline and others as well. So I would say that on the issue of voices, I do genuinely believe that the government and the local authorities are listening. I can't say what the impact will be, but I know that there's a social renewal advisory board for Scotland, and I know there's disabled people represented on that. I'm on that board, and I know that there are disabled people's organisations feeding into it as well. There's a kind of a circle that informs that board specifically about disabled people.
And on the social care review that Derek Feely's doing, there is somebody on that panel who is a gentleman with CP. So
that's right, Jim.
So that is fantastic. I'm afraid we have now gone over time, so I'm very sorry about that. I just finally want to just point out that Cerebral Palsy Scotland have funding for post-lockdown sessions. So if anybody is sitting there thinking, I need help because of the impact of, or just I'm not in the place where I wanted to be or where I should be, we have funded post-lockdown support sessions available. So please get in touch. Graham, there's a final slide, just please get in touch. Yes. So, this is how you get in touch with us. Any which way works. And finally, I'd like to thank you all for bearing with us through this session. It's been absolutely fascinating. Tressa, it's been a delight to see you. I'm sorry it's not in person, but it's been an absolute delight to see you. It's wonderful to be able to welcome you to our conference today. And I think the work you do at GDA is quite superb. And if there's any way we can help and support as we get through all this, please just come and knock on our doors. But thank you for joining us, and thank you for all the work you do.
Thank you. Thank you for inviting me, and the work that you do is absolutely wonderful as well, and have a fantastic conference. It looks like a wonderful programme. All the best and take care.
Thank you, Tressa, and thank you to everybody.